I think we'll start now. Good evening, everyone. Welcome you all to the ninth session of PMIK Whiztalk webinar series. Today, we have Mr. Wilson Padickal, who will give us some insights about the change management in healthcare industry. Just to quickly introduce you to the speaker, Mr. Wilson Padickal is a healthcare management professional who is also a PMP and Prince 2 certified practitioner. He's a certified business analyst and holds a green belt in Lean Six Sigma. He's a subject matter expert in healthcare management with over 10 years of experience in hospital operations and administration, hospital accreditations, service improvement, patient experience enhancement, and staff well-being. He currently works as the Chief Administrator at KIMS Hospital, Kottayam. Before I hand it over to Mr. Wilson, some pointers to be noted. As the session is being recorded, we will take up the questions towards the end of the session. Please feel free to type in your questions in the chat box as and when you have one. And PTU details will also be shared towards the end of the session. Thank you. Over to you, Mr. Wilson.
Yeah. Hello, good evening, everyone. In addition to the introduction that is given by Ms. Divya, I would like to add, I do have around 7 years of experience managing projects as well as programs, both software as well as process improvement in healthcare industry. Okay. So today's topic is change management in the healthcare industry. I hope I'm audible to everyone. So then I can move to the next slide.
Yep.
Okay, as we all of us know, the COVID-19 pandemic has enforced changes on every one of us as well as across the globe on every country. Earlier days, we had to do a lot of preparation with regards to change management as well as, implementing change management projects. But this came as all of a sudden as a hurricane, and we all have become victims of, this COVID-19 pandemic, and all of us are grappling with regard to, how we can get around it and how long do we need to, to be in that motion all the time. So as we can see, it has changed the world, the way we live and work. Also, it has brought major changes, not only in the other business industries as well as in the healthcare industry where I work, which I will be taking you through, through the next few slides. And as we know, with regard to any change, the early adopters of the change become role models, but the later adopters were the worst hit. Even the same is applicable with regard to COVID-19, so which I will explain in a minute. As we know, change is inevitable part of our life, as it contradicts our basic human need for a stable environment. There is always resistance to change, but with regard to COVID, we didn't have much time to resist, but we had to accept it. So it was forced upon it. So now the impending question is, why do organizations change? This is a kind of traditional outlook with regard to change management, implementing into organizations. Because to move from the current state to the future state, as most of your project managers either implementing, software or whatever it may be, it is to take an organization from the current to the future. Always, whenever you take up a change, that brings some kind of, changes or is change driven. And it can be either radical or shift, or it can be slow as well as incremental with regard to how we, implement change. And change also involves, letting the old ways go and getting adjusted to the new ways. And what are the factors that that are influencing change or affecting change? First and foremost, it could be the workplace demographics, like the age of the working population. Because earlier days, we had a lot of elderly people working in the organization. Now we have much younger workforce who are much more agile and open to change. And this could be due to diversity and flexible hours. So when people come from various walks of life or from various countries and various cultures, there is a need for some kind of standardization when we work for the same organization. That could be the reason, once organization is found, somewhere else in the world, when people are employed elsewhere in the world and they do have offices across the world. So the standardization is a must. That could be also a kind of, driver for change. Also, the technological advancement. We know technology keeps changing, and it's very fast paced with regard to healthcare industry. even our equipment and infrastructure, they become obsolete by the time, we manage to procure them. That is the rapid pace of change that we are going through. It could be growth oriented for an organization to keep up the acceleration of growth. Sometimes, we need to be open to change as well as to improve the performance. Sometimes it could be due to the changes in the market, because this is what the customer wants, and based on that, the organizations and businesses need to change to survive in the world. Or it could be due to regulatory requirements with regard to COVID-19 pandemic that has imposed a lot of regulatory requirements with regard to the way we work. It has imposed restrictions with regard to social distancing, work from home, and what percentage of population can be in the office during office hours. Maybe it's 30% of something of that sort across the world in various uh, geographics. So, what are the change management steps? So, this is how the changes is being implemented in a normal organization. First and foremost, we need to make sure that the organization is ready to go for that kind of change management. Organization is mature enough to accept and adopt the change. Then the person has to create a vision. Then an urgency need to be created, because then only you'll get a easier buy-in from the management as well as from the end user. Then we need to build a team which is highly committed as well as motivated. Then we need to constantly communicate and engage the team as well as all the other employees in the organization. And we need to remove obstacles, because there could be a lot of obstacles, especially resistance from the end users. They might think they might not survive once the change is implemented, so they need to be given that kind of confidence, and an excellent training needs to be provided to them, and we need to handle resistance in a much better manner. Then that is the time to implement change. Once we implement the change, we should not be waiting for very large gains. We need to go for low hanging fruits, such as quick wins. Then we let the change mature over the time. Then it is a time to review and reinforce the change, as well as to integrate the change with the organizational vision as well as mission, or the strategy of the organization, and it should become part of the portfolio as well. And if you go through Kubler-Ross change curve, we see, initially whenever a change is introduced, first and foremost, employees, they will show some kind of shock. For them, it might not be acceptable. They think they get shocked initially, because if we say that we are going to change our system from tomorrow onwards, there will be some kind of shock. Then there would be denial, disbelief. They might not agree to it. They think, this might not be for us. It could be for some other organizations. We are based over here, and currently we are doing well. When they understand, nothing else can be done, then they might go into frustration, and eventually into depression. Then they start experiment. They may think it's not that bad. Let's give a try. Then they make the decision. Then it gets integrated. This is the traditional model of change management with regard to resistance. But when we look at COVID-19 enforced change, we can see this curve has flattened, and it was much more faster from shock to integration. There wasn't much time in between. And now I would like to take you through some of the Western healthcare systems as well as Eastern, which are doing really well. When we look at the Western European countries, they do spend more than 10% of their GDP on healthcare. And how the system works is that most of the hospitals are private hospitals. But the question is with regard to who is the one, spending money, and who is the funder. And when we look at countries like Germany, this is heavily tilted towards, employer. The employer needs to buy insurance for all the employees. So the burden, lies on employers. And when we go to other countries like Netherlands, we see the burden is primarily on the government. The government is the one, buying the insurance and paying the premium. And the same model is being followed by some of the, developed countries in the East as well, like Japanese, Singapore, and Thailand systems. As most of you have been to overseas in many of these countries, you are very much familiar with these systems. When we look at the US, there is a very interesting case study. We have seen they do spend 17% of GDP on healthcare, and most of healthcare is provisioned through private healthcare, and it is primarily managed by insurance providers. I think they are the ones dictating terms with regard to what kind of treatment to be given to the patient, whether the patient would require a surgery or not. But with regard to the healthcare system in the US, we have seen only 50% of the population do have some kind of good coverage or comprehensive coverage. Sometimes many of the employees would go on for add-ons paying in some additional premium with regard to eye health as well as for dental health. But when we look at the overall insurance coverage in the US, we have seen that around 50% of the population, either they are undercovered or they don't have any coverage at all. I think that is very baffling to see US being one of the most affluent countries in the world. Half of the population, they can't access, equitable healthcare. That is something that, US is grappling with, even especially this is the talk of the town when the elections are nearing. And when we look at the Cuban and UK healthcare system, those are socialist healthcare systems. Where the government is the funder as well as they are the ones managing the hospitals as well. In the UK, most of these hospitals are set up as NHS Foundation Trust, where even if they make some money out of running the hospitals, but they do spend on expanding the system, but they don't take out any profit out of it. But the government is the one is spending the whole money actually, because there isn't any kind of insurance. Maybe the private insurance covers only less than 1 or 2% of the population. So primarily the whole burden is taken up by the government with regard to funding as well as with regard to running the hospitals. The best thing about the UK is that everybody is having universal healthcare system, but sometimes the waiting list can be very long, the waiting time can be very long. And with regard to Cuban healthcare system also, all the education as well as healthcare is 100% taken up by government, and it's the duty of the government to provide 100% healthcare to all the citizens. But Cuba, not being a developed country, their healthcare infrastructure is obsolete, and uh, they are not in a position to rebuild it. But when we look at the case of India, we see only 1.5% GDP is spent on public healthcare, and which is availed by 26% population of India. And whereas the remaining 74% of population access private healthcare, and for which 4.5% of GDP is spent. Now look at how the various countries have handled COVID. So I'm showing you the top best handling countries as well as top worst handling countries. If you look at some of these countries like Vietnam, Taiwan, Iceland, New Zealand, Singapore, they have done really well. Where this ranking is based on the mortality rate, and very few people have died in all these countries. In most of these countries, the death is less than 10 people or something. The Taiwan is very interesting case actually. Even before the first case was identified, they had put in place national emergency response plan, and that is something that we need to appreciate. And the same with all the other countries, they had a large scale testing of the population, and they put their what do you call it, disaster management system in place well ahead of time, well ahead of all the other countries. When we look at the top hit countries, we see that US, Brazil, and India. Today, India has taken over Brazil actually, because the US, the cases have already crossed 6 million, and in India it has already crossed 45 lakhs, and Brazil is around 4.2 million, and same with Mexico, and Italy was one of the first countries to be hit worse. And even with regard to UK, if you see, the most powerful countries are here on the right hand side of the screen, but when it came to COVID, they were not in a position to deal with it as the much what do you call it, less powerful countries like Vietnam and Taiwan. And in this slide, I will let as KIMS, Kerala Institute of Medical Sciences, what we have done, what are the changes that we have embraced which to improve the patient treatment as well as patient access as well as patient care. First and foremost, we were aware that we need to be empathetic and we need to have human interactions with patients, and we need to respect their independence as well as dignity. Because during COVID, people are a little bit low, they are tensed, and we always take care that we walk them through the system. And the second one is to ensure that we do respect patient rights and responsibilities as well as they are being educated about it. They do have certain rights as well as responsibilities. And the other thing is about patient education and family involvement. The patient, we have ensured that we educate the patient with regard to the complexity of the treatment as well as what are the available modalities of treatment, and the patient is given some kind of option to choose either to go for surgical or medical whenever possible. Also, they are being told what are the complications, if any, and what would be the approximate cost, because at the end of the day, once the treatment is over, they won't get a shock. And with regard to dining and food and nutritional choices, also they are given some kind of leeway based on the given parameters that is the nutritional requirements are met. And we have ensured there is a healing environment, especially when we build hospitals. We ensure that architecture and design is built in such a way which has got sufficient sunlight, which is a kind of thing which would lead to some kind of natural healing. And we have also introduced some kind of smaller entertainment, events, as well as avenues for our patients, like providing PDF books on their iPhones or iPads. Also, we do have television in the rooms. Patients can relax. While they are in a hospital, they don't have to feel they are bedridden and they are in a sick environment. And also, we do encourage spirituality and diversity. And whenever someone is at the end of life care, we call it when someone is nearing death, they are allowed to bring, priest of their own religion, and need to, they can have their, prayer and other things, so that, they feel very calm, as well as for the family. And also, we do encourage integrated therapies, such as, along with the modern medicine, we integrate traditional medicines like Ayurveda and homeopathy, which is also something that people do appreciate, especially, some of the medical tourists coming from the West. Then we promote, health instead of, promoting sickness or curative care. We are more oriented towards promoting health, like vaccination and, creating healthy communities. And these days, these things are even taken up by insurance companies as well, so that, their payout would be much lesser, if all the patients or their customers remain healthy. And these are with regard to safety. What are the things that we have done? I can take you through. We have restricted to one entry and exit point in the hospital for everybody to come and go. And at the entrance, there is thermal screening to see whether the patient is suffering from fever, or if they do have any COVID-related symptoms. If so, they are being sent to a different building. They are not allowed into the entry into the main hospital building, so that there itself we do segregate patients, and they are being seen by doctors and nurses in proper PPE protection, and where their COVID testing is done in case if they do require inpatient admission or surgery. If the patient turns out to be negative, we admit them in the hospital. If they turn out to be positive, we send them to medical college. We don't admit such patients, since we don't have so many beds, whereby we can admit both COVID and non-COVID patients. In addition to that, we have implemented sensor-based hand sanitizer dispenser. This you can see anywhere, even if you walk into a supermarket. This is to ensure that the touch-free environment, that the virus is not spread from one person to other, through touching the sanitizer. Then we do have implemented COVID protocol, like as I've said, fever clinic, as well as regular pathways where people would go into regular office. In case if they need admission or surgeries, again they will have to undergo COVID test. The result is out within 15 minutes, which we call it as a rapid antigen for the regular admission. But if it is for surgery, we go for much more intensive test, which is known as RT-PCR. That will take a day or something to get the result. Only after that we do operate patient. This is for the safety of the patient, because if a patient is COVID positive, then the probability of recovery is very low. In addition to that, we have ensured social distancing. We have marked on the floors, whereby within 1 meter people can stand in the queue, as well as on the chairs we have tied ribbons, ensuring that every alternate chair should be left vacant. And we have ensured that all our staff and doctors are safe. We have provided them with PPEs, face shield, as well as N95 mask. And only fewer visitors are allowed. In addition to that, we are promoting teleconsultation at home healthcare, as well as medicine delivery at home, so that people don't have to come out of their home if they are a regular customer, or even if they are new patients. It is much more safer for patients, because they don't have to venture out during COVID time. And with regard to cost reduction as well, we have implemented some measures. We have reduced operational expenses as well as capital expenses. Currently, we are not investing on infrastructure or equipment. And a faster recovery of receivables. That means, the amount of money that we need to receive from insurance companies, we make sure that we get it, as quickly as possible. Also, natural attrition is something that we appreciate, because we don't believe in layoff or sending out people. And once some people leave the organization, we don't recruit people. We keep the recruitment on hold. This is how we are managing currently, and reducing the use of consumables, as well as reducing the inventory days. So this has helped us to save some bucks. And these are some of the projects that we have done. Actually, if you go through, I can take you through the first one actually to improve the patient satisfaction. What is the change that we need to implement actually? The initiative taken here is restructuring the customer service department, or I can read this one, or insurance patient portal, having a separate portal for our insurance patients. Then there would be a centralized, these are the secondary drivers, centralized customer service department. Also, we will have standardized processes as well as easy claim processing, which leads to improved customer service, and ultimately that leads to improved patient satisfaction. Now, let me take you through the next one. The future of healthcare industry. This is how we look at it. So it will be more of prevention focused than healthcare, curative focused, as I said earlier. And there would be more, increased government spending as well as on healthcare across the world as well as in India. In India, we have already started, so the universal healthcare coverage, like Ayushman Bharat and Karunya, what we have here in Kerala. Also, we will see a lot of innovation in healthcare as well as opening of more multi-specialty hospitals, which are much better than single specialty hospital because all the care is available under the same umbrella, and reducing the fixed cost as well as operational cost, which we have learned during this crisis. And we may have a more competitive market, and everybody would be required to go for hospital accreditation like NABH or JCI, and there would be more informed customers and enhanced customer service as well as enhanced customer satisfaction. So now I would like to have a different outlook on change. Actually, this is very interesting. Let me take you through, because when we talk about change, actually, change is considered something opposite to being, or something as permanent. The being, the definition of being is something that is unchanging. For example, this came from the school of philosophy, from the branch of metaphysics. Actually, the concept of being is, it's all about existence. If you look at several objects in your room, what is common with all these objects, that they exist, and that existence is something permanent. This is like sum of zeros is sum zero, same as even if you put many drops of water, again it is water. Similarly, the several existence would become the, we call it as a single existence. And it started with Aristotle. Aristotle defined being or permanence as, the substance of that particular object. And when we came to, Martin Heidegger, who is one of the modern, metaphysicians, for him, being is something that is already revealing itself to us. Actually, for example, it's not that when we look at an object is revealing itself to us. For example, when we step out, when we see a snake accidentally, the snake is revealing its existence to us. That is called, being revealing itself. But prior to Heidegger, there was Husserl who said, when I look at the screen, intentionally I am going to the screen. So I am the one, who is in search of the being or existence, and I am the one, directing myself to being. And when we look at Wittgenstein, when he sees an object, he says, if I see this phone, he say, I am referring to the original, the perfect idea of a phone. So that way the being is considered as the original reference, the embodiment of perfection. But later Wittgenstein himself has changed the concept of being. He said it's more of the utility, because if the phone doesn't work, it's not a phone any longer. And we had that kind of same concept even in the Eastern philosophical school as well. As even if you look at Shankaracharya, he talked about non-dualism, or Advaita Vedanta. In case he says non-dualism, or Aham Brahmasmi or Tattvamasi, that he says there is only one absolute. So he says it's you as well as it's me. As I said, the drops of water would again make water. Even if it's a glass of water or water in the sea, we call it as water. So this is something similar to that. And there was another, Greek philosopher who was Heraclitus. He said that you cannot stand in the same river twice. He thought being as more of changing phenomenon. So that is something very interesting. And there was another philosopher who understood being as language. Language is not the kind of language that we and speak different languages, like the way we understand a thing, or hermeneutics. For example, when I say a phone, how do you comprehend phone in your brain? It's not in English or in Malayalam or in Hindi, but you do have understanding of that. And when we talk about Buddha, actually, he is the one who was able to merge both concepts together. He said being, or the permanence, is becoming, that is changing. So what he said was, everything keeps changing all the time, though we are not aware of it. For example, even the cells in our body, within 30 seconds, actually around 300 cells are being regenerated, which means they are being destroyed as well as, new ones are being created. So that is very interesting to see, where, the culmination of, being and change, brought together. This is an interesting concept. That's why I wanted to showcase this to you. Then Mahatma Gandhi, the father of our nation, he said, "Be the change you want to see in the world." And I would consider, the change is not something new. And I would consider Sri Buddha as the one of the pioneers of change. Actually, change is as old as humankind or mankind. So now is the time for question and answers. I think we are left with around 2 or 3 minutes. So I welcome any questions.
Thank you, Wilson, for a wonderful session. We have a couple of questions that have come in. The first question, KIMS has brought in a big change in hospitals quality in Kerala. Which benchmark of quality KIMS keep?
Okay, so there are several benchmarks. One is in Joint Commission International, which is the US based. Then we have something similar to that in India. We call it National Board of Hospitals Accreditation, and in KIMS we do have Australian Board of Hospital Accreditation as well. When we look at all these standards, they are more or less the same. If you follow certain benchmarks, and then we it's all about implementing the best practice. So there isn't much difference. So we do follow NABH as well as Australian accreditation. Hospital accreditation. I hope I
Okay.
answered the question.
Yeah. Thank you for that, Wilson. Other question that we have is, what's the biggest challenge that you have faced as a chief administrative for KIMS?
Okay, so when we are on an administrator role, it's
How did
more
you,
of
and how did you manage that?
okay, because as everything keeps changing constantly. Same is with regard to the things in the hospital as well. On a daily basis, it keeps changing. It's not like operations in the olden days, where everything was already set. So it's more like running projects as well, because in parallel we run a lot of projects, making sure that we are at par with international benchmark. So all these striving or initiatives can be considered as individual projects as well. Especially during COVID time, we had to make sure that we had to cut down the cost. Initially it wasn't that easy, because this is a resource intensive sector where the salary of doctors is very high. So we had to do a lot of tweaks to make sure that we can still operate with some kind of profit. I hope I answered. I don't want to get into the nitty-gritties of it.
Thank you, Wilson. I don't see any more questions. Okay. Any other questions anybody has? Please type in. Okay, I think that's it from the question side. Mr. Wilson, for the wonderful session. Give us a sneak peek into the healthcare industry standards and the change management process that you have, and with respect to the safety enhancements, cost reduction, etc. And so, thank you so much for taking your time to share your insights with us. And
Yeah,
thank you. Yes.
I take a special opportunity to thank Ms. Divya as well as Mr. Jayakrishna for organizing this session, as well as for inviting me to speak on this particular topic. And this was I would say, an enchanting session, where I could share my knowledge, as well as some of you are interested in some questions. And if any of you are more interested in the question of being, I would request you to read a little bit of metaphysics, so as well as existentialism, if you want to know how the concept of being is further connected to human existence, and how it can be connected to our day-to-day life.
Okay, thank you, and
That's it.
thank you all for your attention. See you in the next session.
Thank you so much. I look forward to great sessions in the future as well from the other speakers.
Bye bye.
Thank you so much.